So Kirby and Amy, you two have tackled a variety of really important topics in your films, sexual assault among them, all kinds of different things. Why take on the medical device industry?
Well, we tend to like to make films in areas that no one else is. So, like, our films are usually the only film in the territory or sphere that's being interrogated. And we also like to break news. We like to look at things that no one knows about yet and bring that story to the public. So, when we stumbled upon some people who were telling us their stories about what had happened to them, and then we started doing research into the medical device industry and realized that everything we're hearing was as bad, if not worse, than what we were told, we decided we really ought to look into this and the public needs to know about it. So we started making The Bleeding Edge.
Well, tell us a little bit more about the uh, beginnings of the film. I mean, when you set out to do a film, you guys, where do you start? Do you start with your research? Do you start finding your subjects? Where do you begin?
Well, all of that actually. We go out in all directions. I mean, there's hundreds and thousands and tens of thousands of medical devices, and what we found out over the course of our research was thousands of them have huge problems. So we were looking at all directions. We were coming across problems everywhere, and what's interesting is these people, these patients who've been harmed, thought that they were the only one, but in fact, there were hundreds, thousands, tens of thousands of people harmed for each device. So that's where we start. We're shooting as we're researching, and we're editing as we're shooting. So it's kind of a massive kind of march in all directions, and then pulling it together at the end.
And the huge challenge, especially with this film, was that there's an issue that we have to explain to the public that no one knows anything about. There's a tremendous amount of information to get right and impart clearly and concisely so audiences can hear it, and at the same time make a film that's incredibly cinematic and compelling. And that's, I think, what we've kind of, what I think Bleeding Edge does achieve, is that you don't realize you're getting all this information. You're actually just completely enthralled by this incredible story you're watching and unfold before you. So that's the challenge for us. How do we make it a great movie, but also like super informative?
Right, and I think the disturbing thing about it is, we expect our doctors to take care of us. Certainly, it's the same thing with the pharmaceutical industry. We rely on medicine. We rely on these devices to help prolong our lives, in some cases save our lives. And so it's kind of terrifying to think about, how these things can, in a sense, hurt us.
Oh yeah, I mean, we're sold that these are incredibly innovative. They're going to save our lives, but no one's ever told about the risk. Now, one of the reasons is most of these devices that are implanted in people actually aren't tested in people first. So no one really knows what the risks are. And what was really shocking about this is the doctors themselves don't know. And they don't, and even the doctors who are implanting the devices don't know that the devices that are implanted have not been first tested in humans. So the doctors are victims in this whole equation too.
Right. Was there something that you learned during the course of making this movie that was particularly shocking or disturbing? I mean, I guess something like that must have been, I'm guessing.
Well, one of the craziest things is that you can get a device approved on the market if it's similar to another device that's been its predecessor, even if its predecessor has been recalled. That means you can get something approved if it's similar to a product that's been proven to be faulty. That's insane. That's illogical. And yet that's absolutely accurate. That was one of the more shocking things. And also it was shocking for us to learn that this is something that doctors don't know about. We have gotten so many letters, not only from patients, but from doctors thanking us for making this film, saying it's 100% accurate. Thank God you made it. I had no idea.
And even in letters, I mean, we get letters from people in the medical device industry who say, we know this is going on. We're afraid to talk about it at all. If we do, we get fired. So they're glad that this information is out, because there are people even, selling these devices who are seeing the horror that they're causing.
Right. I mean, one of the things that you guys do really well in your movies is, convey the human element of these problems. So I wanted to ask you about the interview subjects in the film. I mean, these people whose lives have been altered for the worse from these medical devices. Can you talk about finding these people and about Was it a struggle getting them to participate in the movie, some of them, or?
Well, at first it was, because they were so suspicious. I mean, they'd been so harmed and they were so suspicious initially. But once they realized, what we were really trying to get the truth out, I think they were very relieved that somebody was finally telling their story. The sad thing is there were so many stories to tell. I think we had wonderful subjects in our film, and then I think one of the reasons they come across so well is Amy does the interviews of these subjects, and she's a phenomenal interviewer, and certainly one of the best in the country. I mean, she did the interviews in The Invisible War and The Hunting Ground, and I think that adds a depth and a humanity to what otherwise might be a more technical film. I mean, you're living with these people as they're going through this, and that's a tribute to Amy's skill.
Very nice. No, that's sweet. Thank you. But it is, I do want to say for those watching that it isn't wonky. It's really like a thriller. And we kind of had the conceit to make it like a thriller. So it really plays, I think, incredibly. I mean, audiences are locked in from the start. We have 100% ratings on Rotten Tomatoes. And I love that one critic said it's the best horror film of 2018, like of all the horror films. And I thought that was an incredible compliment because it's scary with a purpose.
Yeah, I mean, there's a good reason for everyone to see this film, because at some point in their lives, or certainly in the lives of their relatives, there'll be a device implanted, and everybody who's going to get that device is going to think it's going to be great. And if you've seen this film first, you'll know the questions to ask. Otherwise, you're at risk. Your life is at risk.
And he raises a good point, which is also interesting about our work. Like, we broke the story in 2012 of the epidemic of rape in our military. That wasn't on anyone's radar. And look what happened. It led to The Hunting Ground, which talked about assaults on campuses, which in part led to Lady Gaga singing on stage at the Oscars, which led to all the actresses standing up and in tears, realizing, oh my God, if students are speaking out, why aren't we? And I know that, Me Too came out of a whole confluence of things, but I think that our films and the groundbreaking work they did helped usher in Me Too. The reason I'm telling you this is our hope and vision is just similarly, no one's been talking about devices. We all know about Big Pharma. We hope that in 5 years, this will put this issue on the map in a way that it will, everyone will have a shorthand about it, everyone will have awareness, and lives will be saved. Like, maybe there'll be a Me Too medical.
I actually want to ask you questions about those two movies, The Invisible War and The Hunting Ground, because I remember talking to you about them. And you're right. I mean, you guys were kind of ahead of the curve in the sense of, people weren't talking about sexual assault at all. It was just a hidden secret, basically. And, now, of course, there's no avoiding the topic. So, I mean, what does that mean for you to see that your work can have that kind of an impact?
Well, it's very gratifying. And I think it's a real tribute to the survivors in the film, because, there would not be an Invisible War or a Hunting Ground without these women and men having the courage to speak out. And in many ways, it all started from these, courageous women and men in the military.
Go ahead. Where there was no glory or gain, nothing. Actually, it was just hugely risky, and some of them suffered amazing retaliation and retribution. There wasn't public support for this. And it's interesting you raise this. I mean, when we first went out for Invisible War, we pitched it everywhere. We were a fairly well-known team at the time. And we were told time and again, no one wants to hear women's stories. No one wants to hear rape stories, and absolutely no one wants to hear about women being raped in the military. So we couldn't even get funding. I mean, that's how off the radar and uninterested the culture was at that moment. We just sort of said, screw it, we're all in, and, just started, making that film. And I do think that, our country owes a debt to the women and men that spoke out in the Invisible War. I mean, yeah.
One of the disturbing things about this movie in exposing the device industry is that how much profitability is, held up over everything else, especially human lives. Can you talk a bit about that kind of, and it's funny because, these same people who are making profits are probably one day going to have a device themselves. So you think they'd care a little bit more about them working well. But can you talk a bit about that? I guess that disparity between, the corporate need for profitability and the effects that these have on human lives?
Well, look, we live in a capitalist society. You know, these corporations are the kind of driving forces in, you know, developing these devices. So what do we need to sort of protect the public? We need a strong FDA, a strong regulation that's overseeing that. So let these companies come up with these things, but let's have the FDA test them first. And right now, that isn't what's happening. And that's, when you ask about what was shocking, that was another thing that was shocking, is that we all assume that the FDA is doing its job on this. Absolutely not.
Yeah, what we heard time and again, the phrase, which was chilling, is it's a captive agency, meaning it's captured by the industry, and it really just does its bidding. And we didn't find that to be untrue. I thought that was hyperbolic, and it actually sadly wasn't.
Yeah.
Yeah, and I mean, it's the same thing with pharmaceuticals, where, you know, another point that this movie makes is we rush to get things out on the market. And on the one hand, I mean, there is the need to try to have medical innovation, to try to help as many people as possible, as quickly as possible. But I mean, there is, I guess, something to be said for just waiting a moment and seeing how these things affect us, you know, like opioids, for instance, and certainly all the devices we have.
Or in life and death situations, when you're saying, okay, there is an urgency to it, full transparency. You know, let the patient know this hasn't been tested, you know, blah, blah, blah. But we don't know that. I mean, again, another shocking thing, which is that we're all guinea pigs, essentially, and we don't know it. And that's just shouldn't be.
And then to go back to Big Pharma, I mean, what's interesting is, you know, there's been a lot of writing on Big Pharma. There's been a lot of investigation on Big Pharma. And there's been so little look into this industry, which is really a parallel industry. And it was, you know, 30, 40 years ago, everybody thought Big Pharma was just a golden industry. I think it was the #2 most respected industry in the country. And now, of course, it isn't. And I think the same kind of scrutiny has to be put on the medical device industry. And that's what we did. I mean, that's what this, you know, the process of a 2-year investigation, looking in, you know, throughout the entire industry. We hope that that's the beginning of really a map, you know, that other journalists, other filmmakers will go into this territory and help to change the landscape in the way the perspective on Big Pharma has been changed over the last several decades.
Your films have been able to, you know, break through with audiences and critics and also awards groups, you know, nominations at the Oscars, the Emmys and such. What does that recognition mean for you two in your careers?
It just means a tremendous amount for the issues, honestly. I mean, I think that, like, we got letters around the globe when The Hunting Ground was, you know, showcased at the Oscars, and it just was and also I got letters from activists saying this is a watershed moment. Like, never globally, you know, this is pre the Weinstein, has this issue gotten this kind of platform and public embrace. So that was always that for me. And even, you know, Invisible War, it was so wonderful. And it, you know, the most wonderful thing was having the women in the military be able to come to the Oscars. I mean, that, you know, awards are nice, but it's just so gratifying. And having the military people recognized in that way, you know, so for us, I mean, the win is, you know, obviously it's nice getting awards, but it is really nice also for us because it means so much validation to so many people who are marginalized and oppressed in our society that it's a nice thing for them.
And I think also what really means something to us is how this affects the issue. I mean, you know, for the Invisible War, 35 reforms were passed through Congress and signed into law. With the Hunting Ground, there were, you know, thousands of colleges and universities changed policy. We know that there's an incredible discussion going on right now throughout the medical device industry about this issue. I mean, this is, you know, this is a real challenge when you're making a film, to make a film that does appeal to audiences, that does get nominated, but at the same time speaks to members of Congress, speaks to the entire industry. And that's something that, you know, we put all of our filmmaking sort of efforts into that direction to reach all those audiences.
Yeah, and also that not only did Hunting Ground and Invisible War impact legislation, but the Bleeding Edge already has forced one of the companies we profile to take one of the products that we profile off the market. So we also like are very, that's more meaningful to us than anything, honestly, is when our films have this kind of social and global impact, you know.
Well, it's a sobering and important documentary. I look forward to seeing what you do next. I'm sure that most companies in America are always afraid when you two come knocking and say you want to make a movie. Thank you both so much. Pleasure talking with you.
Thank you.
Thank you.